Welcome back. Today, the University of Minnesota Board of Regents voiced its support for a potential merger between Fairview and Essentia Health Systems. But with Fairview shooting down the idea earlier this week, rural hospitals across the state are running out of time. At least 6 have closed, and more than half don't have a dedicated emergency physician. Amid the uncertainty, a local company is now stepping in with a new approach to staffing. Jennifer Hoff has the story.
The halls of a hospital about to close can be quite creepy. Mixed too with a sense of sadness about the loss. That happened twice last year in western Wisconsin alone, and even more so across the country.
Correct.
Something Melissa Daniel Bain knows all too well.
Being from rural Alabama, being in a place where healthcare resources are limited, I've seen the effects it's had on my family. And you start to realize how important healthcare is and how important access to quality healthcare is.
Data shows 50% of rural hospitals operate in the red. Staffing shortages are worsening, and fixing it might feel unimaginable.
The aha moment was when I started talking to the team.
Post and claim shifts with the Parrot MD mobile app.
The team, though, is using something we all do to shake up an industry to try and save one hospital at a time.
Parrot MD launched a little over a year ago, and it acts like a matchmaking app, connecting hospitals directly with available doctors to fill staffing shortages and reduce costs.
Jim Taps Save Shift.
We are a representative, a business partner, however, there's many words you can use to what we do, but it's definitely a unique space.
Nearly a dozen hospitals in Minnesota are now staffed through the app. That still ensures doctors endure a rigorous vetting process. One Daniel Bain says is more affordable than other companies representing temporary or travel-based physicians.
The way we do that is because we are just a flat fee platform, because we are built pretty lean, because we're able to utilize technology, and quite frankly, because we're willing, right, to cut some of the fat that doesn't need to be in the middle.
There are nearly 80 rural hospitals across the state that by law have to be continuously staffed, called critical access, like the 10 where ER Dr. Paul Allegro works, from Ely to Bemidji and in between.
And my real push is to try to help staff these rural hospitals and grow awareness around that.
He supports the app. He says creates connections, fosters recruitment, and streamlines a process in a tech-friendly way with plenty of safeguards.
The idea that somebody who's less than would be credentialed and be able to navigate all those hoops is just no longer possible. It may have been years ago, but not in the present era.
Doctors will tell you geography shouldn't dictate care. And so too will the people at Parrot MD, finding sustainable solutions for a problem that seemed hard-pressed to fix.
Physicians are happy, our facilities are happy, and it's like, okay, this is really cool, and it's really amazing to be a part of that.
In Minneapolis, Jennifer Hoff, KARE 11 News.
The app mostly works with emergency medicine physicians, but they're trying to launch a space for obstetricians and advanced practice nurses who administer anesthesia, many of whom hospitals already rely on.